Alright guys, hello, welcome to my YouTube channel Health Insights Hub. Today we would consider a very serious medical condition called pyelonephritis. So let's begin. What is pyelonephritis? By its simple and clear definition, pyelonephritis is simply a bacterial infection and inflammation of one or both of the kidneys, and it's usually a type of urinary tract infection that occurs when bacteria travels upward from the bladder through the ureters to the kidneys. So, if it's left untreated, it could cause permanent kidney damage, kidney abscesses, or it could also spread into the bloodstream, thereby resulting into what we call sepsis, which is a life-threatening condition. That's blood infection. So, you could see a clear image of a normal kidney as well as a pyelonephritic kidney. You could see inflammation, scarring, atrophy of the cortex of the kidney, as well as collection of pus within the renal medulla. So this image also shows the difference between a normal kidney and a pyelonephritic kidney. Clearly, we could see in this also a shrunken or atrophic kidney, that's a decreased kidney size, depressed pit on cortical surface indicating cortical scarring, and also cortical hemorrhage, which is bleeding on the kidney structure. So let's have a brief anatomy of the urinary tract or system. What is the urinary tract or system? It is a system that is typically made up of two kidneys, two ureters, the urinary bladder, and the urethra. The kidneys are two structures side by side. Meanwhile, we have the ureters, which are two black structures that convey substances from the urine down to the urinary bladder. The kidneys are saddled with the functions of filtering waste products and excess water from the blood in order to produce urine, which on the other hand flows from the kidneys through the ureters into the bladder, whereby it's stored for a certain period of time before leaving the body through the urethra. Also, you could see an image of the urinary system both in males and in females. You will see the prostate clearly stated and displayed in the male structure. So, what are the types of pyelonephritis? Pyelonephritis could come in two types or forms. First, we have the acute pyelonephritis, which is a sudden bacterial infection of the kidneys that develops rapidly. This type of pyelonephritis usually responds well to prompt antibiotic treatment. We equally have the chronic pyelonephritis. Chronic, it's a long-term inflammation of the kidneys, and it's usually caused by recurrent or persistent infections. If this is left over time, it could result into kidney scarring, reduced kidney function, and eventually chronic kidney disease. So we could see this clear delineation of the acute and chronic kidney structures clearly displayed in this image. So what are the common causes of pyelonephritis? Typically, pyelonephritis is being caused by infection through Escherichia coli, which is a bacterium that is normally found in the intestines. Although other bacteria could also be responsible for causing pyelonephritis, and they include Klebsiella, Proteus, Pseudomonas, and Enterococcus species. Other causes and risk factors that could be responsible for pyelonephritis include untreated urinary tract infection, that is UTI, nephrolithiasis, which is kidney stones within the kidney that could also result into urinary obstruction, vesicoureteral reflux, which is backflow of urine from the bladder to the kidneys, and also enlarged prostate, that's in males. So we also have urinary catheterization, structural abnormalities of the urinary tract, diabetes mellitus, pregnancy, and also weakened immune system. So, what are the signs and symptoms of pyelonephritis we could watch out for? First, we have high fever, chills, flank pain, which is pain on the side of the back below the ribs, costovertebral angle tenderness, dysuria, which is painful urination, frequent urination, urinary urgency, cloudy or foul-smelling urine, hematuria, which is blood in the urine, nausea and vomiting, and also malaise, which is general body weakness. So, what are some of the common methods of diagnosis of pyelonephritis? First and foremost, we have medical history. Secondly, we have physical examination based on height, body weight, and some other physical changes we could notice. We equally have some laboratory investigations which include urinalysis, urine microscopy, urine culture and antibiotic sensitivity testing, complete blood counts, CBC, blood cultures, which is especially in severe cases, serum creatinine and blood urine nitrogen, BUN, C-reaction protein, CRP, and erythrocyte sedimentation rates, ESR. We equally have some imaging studies that are very viable and useful to the diagnosis of pyelonephritis. First and foremost, we have ultrasound, which is the first line of action. It's non-ionizing in nature and very safe and usually very cheap to acquire. We equally have computed tomography CT scans that give a cross-sectional image of the human anatomy. We equally have magnetic resonance imaging that has high soft tissue detail. We equally have nuclear medicine, which makes use of radioisotopes to detect some specific metabolic conditions. You could see here on the right kidney and the left kidney, you could see clearly displayed pyelonephritic kidneys, shrunken in the cortex and also within the medullary region. We could also see this as a CT scan cross-section across the level of the kidneys, showing decreased size of the kidneys, cortical scarring, depicting pyelonephritis. We could also see this MRI image of both kidneys, left and right, having typical features of pyelonephritis. You could see on the left and on the right, shrunken kidneys, cortical scarring, and also hemorrhage, which is bleeding on the cortical structures. This is also a nuclear medicine modality that is making use of some radioisotopes, 68 gallium ligand, to visualize the kidneys, as you could see typically on this image. So, what are some of the possible treatments of pyelonephritis? First, appropriate antibiotics, which are based on cultural results. Secondly, we have intravenous fluids for dehydration, pain relief and fever control. We should also have hospital admission, that's in severe infections, and treatment of any urinary obstruction. Secondly, we also have complications of pyelonephritis. If left untreated, what are conditions it could cause? We have renal abscess, kidney scarring, acute kidney injury, chronic kidney disease, hypertension, sepsis, and also septic shock. So, some viable methods of prevention include drinking adequate amounts of water at all times, staying hydrated at all times to improve kidney function. We equally have treating urinary tract infections promptly, maintaining good personal hygiene and cleanliness, regular emptying of the bladder, proper management of diabetes, and also seeking medical attention for recurrent urinary symptoms. Alright, thank you for listening, and do well to subscribe to my YouTube channel. More information, more updates on health talk coming forward. Thank you.